Hi, I am Dr. Manjunath, consultant pulmonologist, Gleneagles Hospitals, Kengeri, Bangalore. Today I will be speaking about lung cancer because November month is the month where we try to make aware about lung cancer. So it's been celebrated as Lung Cancer Awareness Month. So what is lung cancer? Lung cancer means cancer affecting the lungs. Abnormal growth of a tissue within the lungs is called lung cancer. What are the causes? Who are all risk factors for getting lung cancer? The patients with smokers, those who have got exposed to second-hand smoking, like somebody else in the family, somebody else in the workplace, or the partners who are smoking, they can also get increased risk of lung cancer. Another risk factors is air pollution, indoor or outdoor air pollution, that will also increases the risk of lung cancer. Exposure to chemicals like asbestos, cadmium, radon, those are also have increased risk of lung cancers. If there is a family history of any form of cancers, whether it could be lung cancer or any other form of cancer, they are also have to get screened themselves about lung cancers. So what are the symptoms of lung cancer? Lung cancer patients, they usually come up with cough, sputum, blood tinged sputum, and breathlessness, weight loss. So these are all the commonly seen symptoms in a lung cancer. When they get these type of symptoms with background history of increased risk factors, so they should consult doctors as early as possible, because earlier we diagnose any cancers, better will be the treatment. So what we do when the patient comes with these symptoms with risk factors of lung cancer, we do CT scan to screen what is the whether she has got any features suggestive of lung cancer. Then we do PET scan. PET scan is the one which we do screen whole body, where we try to detect is there any spread of cancer from any other part of the lung, any other part of the body apart from the lungs. So when you do staging, PET scan helps in doing staging. Like if there is only confined to the lung, it will be stage 1 or 2. If it is away from the lung, then it will be stage 3 or stage 4. So other tests what we do is like we do pulmonary function test to identify what is the lung capacity, whether the patient can be a candidate for surgery or not. So then once you identify there is a lung cancer in the body, in the lungs, so then we do diagnosis by doing a biopsy. Biopsy can be done in two ways. One is by doing a bronchoscopy and doing a biopsy. Second one, if the patients, if the lung cancers are not amenable for bronchoscopic biopsy, if they are very peripheral, then we can do what you call CT guided biopsy. So in bronchoscopy, we will introduce a small tube with attached camera through the mouth or nose, and we will enter the area, airways, where there is a tumorous tissue growth. So then we will take multiple bites of tissue from there, and that we will send it for analysis. So then we will identify whether it is lung cancer and what are the types of lung cancer. In lung cancer, majorly we divide into two different types. One is small cell cancers, another one is non-small cell cancers. In non-small cell cancer, we have got another multiple types of lung cancers in non-small cell cancer as well. So once we get to know the diagnosis, there are different like molecular tests we do in the lung cancer tissue. Like especially when you detect adenocarcinoma. Adenocarcinoma, what we tell is it is the better cancer among these types of lung cancer. So if we get an adenocarcinoma, then we do some molecular testing. If the patients get EGFR positive, so then the treatment will be better and survival will be better. So the treatment options depends on what are the types of lung cancer and what are the stages of lung cancer. So before coming to diagnosis, whom I have to screen for detecting cancer? As I said earlier diagnosis is the better for earlier treatment and better survival. So those who have got exposure to smoke, exposure to tobacco, second-hand exposure to chemicals, family history of cancer, these are the patients who should get themselves screened for lung cancer. So when you do a lung cancer screening, we do only low dose CT, which is easily available everywhere. Once you detect early, then we can do biopsy and we can remove completely the lung cancer tissues. So after diagnosing, then we will do treatment in the form of either surgery if the early stages like stage 1 or stage 2. If it is advanced stage, then we will do chemotherapy depending on treatment, depending on the biopsy specimen, what is the types of lung cancer. So this is about lung cancer. So I, as a pulmonologist who see many patients with lung cancer, earlier we have to detect for better treatment. So those who have got history of risk factors should get screened for lung cancer. Thank you.